We're going to be talking about that tomorrow as well on our NACMA call. So, but basically, we're going to go into it being extremely cautious, and they're going to have like mandated orders as far as like how many people can gather. And as we all know, that really is going to affect us in aquatics, because our facilities really range in how many people we can allow into our facilities. But of course, we'd want to be at maximum capacity, and we'll see how that is going to go. So that information is still pending. We're also looking at things like having to wear masks and stuff, and then there's going to be barriers as it pertains to swim lessons and other things. So just things to start thinking about at this time. Just posing the question out there right now. Does anybody have additional resources for support of public agencies, for counties, cities, special districts? Is there anything out there that has come to anybody's attention that we should be aware of that we need to distribute to our general aquatic community? If there is anything, go ahead, either raise your hand or unmute yourself and just speak up. Or you can put it over in the sidebar. Stephanie, thank you for mentioning that we're recording. Okay. All right. Okay, so as we get more information, if you are an aquatic section member, Lauren, our secretary, and thank you for doing this, on a weekly basis, she has been sending out Monday updates. Any information we gain, we will go ahead and make sure gets put in there for you guys. And then Peter, I'm going to go ahead and pass it off on to you. I know we talked about potential legislation updates, and there's not a lot out there, even though some is pending, but do you want to go ahead and talk about the call you were on this morning a little bit?
Yeah. Hi, everyone. This is Peter Byers from City of Newark. I'm your aquatic section legislative rep. So this morning I had the opportunity to jump on a Zoom call from the Texas Public Pool Council, and they are tppc.org if you want to look them up, and I highly encourage you to do so. They are doing similar things there that we are doing here, having a weekly Zoom meeting. One of the things they put out was a survey to their members. So their membership is about 350 strong, and it does not just include Texas. So they will include everybody within the survey that wants to put it out or wants to participate. And I will, or Terry will, put a link for you guys in the chat so that you can do so, or just go on to tppc.org, and they have a whole section on COVID-19. So it was really interesting to be on that call. They went through their survey results currently, so they have 60 people who have already filled out the survey. They have regional elements that they reviewed, as well as some of the other question pieces. And it is very interesting to see some of the responses from people looking to open as early as next week in certain parts of the country, and others being closed for the entire summer. So it, definitely ranges the gamut. There was also a posting, Minneapolis, I guess, has shut down their water parks and every aquatic venue in that region for the bulk of the summer. So it will be interesting as we move forward as to where we all go. Also on that website, there were 2 other meetings that I think you should be tuned into. So there's a Facebook Live from Lifeguard Authority Group that will be on Friday, I believe at 10 a.m. This is Justin Stemstrott, which many of you guys know as he was a speaker at CAMS, medical doctor, and he will be kind of going through some of the medical elements that we will be dealing with once we reopen. And NERSA will be having a roundtable on Wednesday at 11 a.m. for college-based folks. So I thought those would be two really good resources for you guys to go and participate or just listen in to see what they have to say. I did send an email out to the Texas group because they want to also be involved in anyone else who's doing these Zoom conferences so that they can share what everyone else is doing around the country and we can all be connected together, which I think is great. So we're all in the same boat, but everybody's coming at it from different angles. One of the things I encourage you guys all to do, based upon Governor Newsom's 6-part plan that he laid out yesterday at the news conference, is really start honing in how you're going to reopen with the most restrictive elements. We've already done that a little bit here, identifying how our new normal is going to be initially. And then obviously as restrictions start lifting more, we can loosen up some of the requirements that we're putting in place. But some of the things you may want to think about is beyond masks, maybe sneeze guards or protective areas at your front desk, thermo scanning of individuals coming in. It sounds crazy, but it's probably going to be necessary for the limited short term for us to start thinking in those ways. As far as legislative elements, I apologize. I've been, like you, crazy busy with different things and having to do park patrols and things like that I haven't had time to look at that, but I have it on my radar so that next week, hopefully I'll come with an update on whatever I can find for you. Other than that, I think that is it. I will put, a couple of links as other people talk to those meetings, etc., so that you'll have them to refer to. So I think that is it, unless people have questions for me.
If you guys have a question, again, just go ahead and unmute yourself and feel free to ask it or pop it into the chat. We are monitoring the chat. Peter, thank you very much. I appreciate it. I don't think they actually had a legislative meeting this week. So yeah, but I think we're going to be looking at some legislation here coming. So we'll do our best to keep everybody tapped in as much as possible. Okay, so the other thing we wanted to make sure as far as our current state of affairs and then new requirements, Andrew Hubbard, our current vice president, do you want to ask that question that you had about the county health?
Yeah, sure. Hi, everybody. Andrew Hubbard, City of San Ramon, your Aquatics section vice president. So it sounds like we're all waiting, we're all kind of guessing. We're all starting to think about, how this might look when we come out of this. And we're, like I said, we're guessing. I'm curious if anybody's had a chance to reach out to their local county health departments and actually have a conversation with somebody from that agency as to how they think things might look when this is all not over, but when we at least come out of shelter-in-place requirement. So I know we've reached out to Contra Costa County, haven't heard back yet. I'm just curious if there's any counties that have actually come out and had that conversation with any of you out there.
Kelly, you posted something in chat. Do you want to unmute or do you just want me to read it? So I have in Stanislaus County, they have only let us know they're shut down in regards to inspections. So to piggyback off of that, yeah, inspections also for our slides and stuff from DOSH is also shut down right now too. All of those have been canceled. So thank you, Kelly. Anybody else hear anything about their from their counties?
Jay Showalter, City of West Sacramento. I got an email from Yolo County stating that due to the stay in place order, all public pools in our area were closed through May 1st. I haven't got an update as if they're going to extend that. But as of right now, we couldn't do anything, at least by a county health code, to even open our facility if we would wanted to.
Yeah. Okay. Thanks, Jay. I appreciate it. In the sidebar of the group chat, Peter posted some of those links for you guys over there as well.
Hey, Terry, can I add on
Yeah.
one more question? So I'm curious if anybody's had a conversation or thought about from a lifeguarding perspective, you know, what if there's social distancing requirements and things like that, how does it relate to providing care and making rescues and doing CPR and stuff like that? I know that obviously first responders, EMTs, things of that nature, they might be donning different PPEs and preparing to actually do physical contact with a victim, but that's a little bit different from, you know, a guard in a chair jumping into the pool with very little time to don all that gear. Has anybody gotten any insight on anything like that?
So Andrew, that's actually perfect segue into kind of more of like our training aspect for staff, which was kind of next on my list. So thank you, because we are going to have those physical distancing requirements. You know, how are we going to do our certifications? What are we going to do to keep our staff safe? I've had this conversation with a couple of different people outside of my agency, because these are all questions and they're asking me what we're doing, but right now we don't know, because we're actually looking to agencies like Red Cross and maybe some of the other training agencies for their training guidelines before we move forward. Has anybody else had a chance to have those discussions yet? Well, Tara from Red Cross did tell me they have some updates, so this is probably a good time to hear from Red Cross. Tara, are you on the call? I see Zach on there.
Yeah, I'm here. Zachary's here as well. So on that specifically, we did put out some information on Monday. So if you haven't been on the Learning Center to the COVID-19 guidance page, I would recommend doing that. There's a specific document and it's called COVID-19 FAQ from our Scientific Advisory Council. So that document specifically talks about the question of what are the implications for resuscitation for lay responders, first responders, etc., for both in and out of hospital resuscitation. So it does address some of that. So I would just recommend you take a look at that. I couldn't summarize the whole document, but there is quite a bit of information there now if you wanted to take a look at that. Terry, do you want me to continue on with my updates or continue this conversation? I have a couple different things.
So Corey Riley, District 3 had mentioned, I think Andrew's question about PPE for lifeguards is a great question for Lifeguard Authority on Facebook on Friday.
Mm-hmm.
One of the things that I want to make sure everybody is aware, we actually save these chats after our meetings. And if you guys have anything you want to put in there, we'll see what we can do. Joey runs Lifeguard Authority, and maybe we can shoot some of this information, some of these questions over to them prior to Friday to get some of these questions answered. So if you guys have anything more that you want to throw in the chat, go ahead and throw it in there. Does anybody else want to speak on Andrew's and our staff, protection of staff? Okay.
Yeah, I'm looking at this document, Terry, and it's like a good 6 pages. So it has some good info in there. So I would definitely take a look at that.
Cool. Yeah, Terry, if you want to continue on with Red Cross updates.
Okay,
that'd be great.
Perfect. Sounds good. So the biggest thing I wanted to mention today, I think last week, someone had asked, I think it may have been Adam or someone else had asked if we can do any lecture virtually. So last week our answer was no. Literally as soon as we got off this call, we got a little more information that is something that we're going to allow. So again, take a look at the COVID-19 guidance page. It talks specifically about that and what the expectations are for you guys when you're doing that. As far as lifeguarding goes, the biggest thing for you guys to be aware of, you obviously need to follow your instructor's manual, have that available when you're teaching virtually. You need to make sure you're following the outline, basically like you're teaching the class as if you were in person. It needs to be live. It can't be pre-recorded. Students need to be able to be on there live, ask questions, need to follow basic ratios, you know, for that. So I think that was definitely a great update. Hopefully that helps some of you guys, again, if you do the blended learning, and then try and get some virtual lecture done to be able to cut out, again, some of that in-person course time. So there's also some information on there for like our lay responder classes and BLS, if anyone does that. We've made some program modifications where you guys can actually do some of the skills checks online. So that's unfortunately not for lifeguarding. As we know, you can't get do virtual in the pool. But for lay responder and BLS, we are allowing some virtual lecture, virtual skills, and you can actually do the exams over a virtual capacity. So we're not giving any you know, restrictions onto what systems you can use. As long as you can be on video, your students can be there, you can be live. Again, you can teach virtually. Another update for that, we are allowing or giving some discounts for our online only classes. So those of you that are looking for things to keep your staff busy, if your staff are still on payroll and getting paid and training and things like that, we're doing some online only classes as far as like lifeguarding management, safety training for swim coaches. You guys as the LTP can actually offer those to the public rather than going to redcross.org. So it would be a 50% discount on those if you set it up through your organization, like via blended learning request. And then lastly, we talked again last week about the 90-day extension and what that looks like. We got word that a 120-day extension should also be coming out. We're realizing that 90 days may not be quite realistic for everyone. So, you know, just kind of paying attention to the times and making sure that we're offering things that really help you guys out. We should be releasing, you know, some more formalized communication on that 120-day extension. It's going to be the same process, you know, submitting a course record, doing all of that. So if you've already submitted the 90, great. If you need more time, that 120 should be coming out. Once the 120 comes out, our understanding is that the 90-day, you know, it's going to go away at that point. So you won't have both options. But those, I believe, are the options or updates I have for now, if anyone has questions.
Hey, Tara, really quickly, if we've already put in for the 90-day extension, are we going to have to re-put in for the 120-day, or is that going to be automatic?
It's not going to be automatic. So if you do recognize that you need the extra time, you will have to put in another request. And I see Colin's question here, will it stack? No, the 90-day will, or I'm sorry, the 120 would supersede the 90. So it's not going to give you 90 days and then another 120 off of that. So we just basically realized, you know, again, with how things are going, 90 days might not be enough. So we're going to change it to 120 for anyone moving forward, and anyone that, you know, would prefer to go back in and put another, you know, different request to get that additional time, you can do that.
I have a quick question on blended learning recertification, and if this is already covered, please forgive my ignorance. I've never taught a blended learning course before. We've always done it in person. Is there like a time limit from when you can do the online portion and the virtual lecture, and then when you finally get in the water?
Nope. No, that's up to you. I mean, obviously the less time you have in between, the more, you know, information they're going to retain and things like that. But no, there's no requirement. I want to say for all of our classes, I mean, lifeguarding specifically, I can tell you no, you can span that over however much time you need.
Awesome. Thank you.
Mm-hmm.
Thanks, Tara.
Yeah.
Just any more questions?
I got a private message here. So it says, when it comes to teaching the water portion, are we able to teach with 6 feet apart and have the students rescue a dummy, a mannequin? No. So right now, I mean, the social distancing requirements don't allow us to do anything aquatic. So if social distancing is still in place, once you get the okay, you're gonna have to get, I mean, it's gonna be, I don't know how to answer that. Right now, social distancing, you still can't teach lifeguarding. So if that's your local restriction, unfortunately, you're just gonna have to hold off until you get the clear to move forward without the social distancing guidelines. Does that make sense?
Since we have you guys, are you guys working on anything in regards to lesson physical distancing guidelines, or anybody else on the call outside a different group other than Red Cross? We're open to all suggestions at this point.
Yeah, I mean, same thing for us again on that one. It's follow your local guidelines.
Hi, this is Peter. So one of our things we have been looking at is that component of swim lessons and how do we do that realistically. So some of our scenarios base out for your lower levels to now include your parent or someone within the home, and the instructor instructs from the deck and guides them through, similar to a mommy and me, but with more detail and information. So we're kind of looking at that and looking at everything from a private lesson standpoint. And so those that are now in level 3, 4, 5 that have some mobility, have some safety elements that they could go with an instructor, it would still be a one-on-one piece. So that's kind of what we're looking at in formulation of swim lessons, at least temporarily, initially, is kind of how we're approaching it.
Okay.
Terry, someone was asking about social distancing for like in service and things like that. One thing I forgot to mention, we put out a toolkit for lifeguard training and operations. So it just talks about some more policy specific exceptions, different aquatic support, different ways to considerations on holding in service. So again, just another resource as far as Red Cross training is concerned for you guys to be aware of.
Tara, is that only accessible through instructors' corners at this point for ITs and LGIs?
It is available in the Red Cross Learning Center. Yes, but not only for instructors. So if you, I'll take the link and put it in here. Anyone can access our guidance page, so you don't have to log in to get to that guidance specific page.
Cool, thank you. Okay. All right. Thanks, Zachary, for putting that in there. I appreciate that. Does anybody have any other questions for Zachary or Tara or anybody else Red Cross on the call?
Yeah, Jolie is here too, sorry.
Yeah, I got 5 pages of people, 5 screens of people. So Zachary and Tara just happened to be on my first page.
Hi, everybody. I'm here.
Hey. So, okay. All righty. Well, why don't we, so we talked a little bit about certification classes and staff training. What about reinstatement of staff and new hires? Is there anything new anybody would like to share? I mean, for our district, Kasuma CSD, I don't have any updates from our HR at this point. We're still frozen. But I love hearing when people are telling me, because then I can take it back to my uppers, that they're still able to do Zoom hiring videos and interviews and such. So if anybody has anything more to share about that, that'd be great. And I apologize for my dog barking in the background.
Hey, Tara, it's Lauren, or Terry, sorry. Red Cross is on my mind. So as far as north of the river in Bakersfield, in regards to returning lifeguards that we are rehiring, I got with our HR department and I actually mailed them a lot of the payroll paperwork that they can just send back. And I also emailed certain things. So when we had mailed the hard copies, because certain things obviously have to be on certain paper, we included a self-addressed envelope that they just print them off, put them in there, and send it back. So when we are up and running and able to put them officially back on payroll, that's a lot of steps we don't have to take because we already have those in hand. So that has been really beneficial for us. And it also just keeps track of staff. Like for me personally, I told them to email me when they mailed it. So just with the mail and everything, I can kind of keep an eye out for it. But that's, like I said, only regarding returning lifeguards that we are rehiring back.
Yeah, all of that is helpful information. Anybody else want to talk about what they're doing, or if they've done anything that has worked so far within the last week or so?
Terry, at this point from our HR department, I can reinstate previously hired staff, but they put a complete hiring freeze on hiring new people. Just in the threat that we may actually have to cancel our summer. They don't want to go through all the cost of hiring these people just to let them know that we don't have a job for them. So I can reinstate old people, but can't do anything right now with newbies.
In Patterson, we're still going through with our recruitment, and we just had a full-time staff meeting the other day, and the woman who's kind of spearheading our recruitment made it very clear that we're going ahead with recruitment and not, she didn't have anything to say about once the recruitment is done. So I'm kind of thinking they're going towards considering not hiring, because she said, oh, hiring is still happening, and then she was like, oh, excuse me, recruitment is still happening. So I was like, oh, that's kind of ominous, but we'll see. Hopefully I'll have an update in the next couple weeks.
Thanks, Kelly. Holly from Davis, you're continuing to hire new staff contingent upon completion of certification. Colin from Sunrise, he will be emailing out rehire packets. We have fillable forms. So fill-in forms, I'm assuming. Yeah. Cool. Thanks, guys. Okay. Anything?
Can I ask a question?
Of course.
Has anybody started to have any like pushback from their returning staff that they are either scared to come back to work or unwilling to come back to work, or their parents won't let them work, or maybe everybody's down to come back to work because we're lifeguards and we don't really, we're ready to roll. So I'm just curious if anybody has any feedback on that.
Hi, my name is Maraid. I'm the operations supervisor at the Humboldt Bay Aquatics Center. We're directly connected with a university, Humboldt State University, and so most of our staff are students, which has made, I think, the biggest impact on their availability to come back or not. Some students have had to move home and go be with their parents, so they're no longer in the area. Some students are here kind of just struggling to get by. We've also had to pay out our staff as part of a university. I'm trying to support students, so we paid out our student staff through May. So now it's more of a point of whether or not we can even offer them work because of the financial situation we've been put in and not being able to know if we're going to have jobs for them. So that's kind of our current position.
Thank you for sharing. So let's see, Kelly, Sargent has mentioned that parents are concerned. We've had that issue too, but nobody said they're not returning at this point. I think since we're following what the school district is doing, they haven't actually, I think until we actually start bringing people back, we're not going to hear about pushback at this point. Beth from El Cerrito, they haven't received any pushback. Brittany, all of our lifeguards have asked about hours. They want to come back. Peter Byers, part-time staff, it's been very quiet for Newark. Oh my gosh, you guys are going too fast. Does anybody want to jump in? And so you don't have to hear my voice the whole time? Can you
Yeah,
tell?
so my staff have been begging to come back. I had a lot of college kids that were gone. And as soon as they went virtual and kind of had to move home, they all were emailing me, which I'm fairly new to my position. I'm in La Mesa, just outside of San Diego. And they, my staff that have been around year round have said that nobody's ever this, good at communication. So everyone's been really good about letting me know their availability and what they can do. My lifeguards are doing an emergency operations center day camp for essential staff that are still having to come to work. So they're working in that capacity. I did have a handful of staff come to me, said that they were uncomfortable due to elderly family members that they'd be in contact with, or people who have their own children that they were worried about, and just kind of the contact with all of the different day camp kids. But we've had more than enough that can go through and kind of fill the staffing. So they are all very interested in coming through, coming back and getting hours. And yeah, I'm in La Mesa, just outside of San Diego.
Thank you, Brooke. Erin from, I forget what town of Windsor, I believe. She had previously asked if other agencies' part-time staff has been released. My agency, all but 4 have actually been released, but we've been told we can't work the 4 that we have. So for aquatics, that doesn't count our other sections that our district has. So if your agency also released part-time staff, go ahead and pop that into the chat. Curious how many kids, I think Rachel, you're from Calistoga. Curious how many kids you have in that camp. So this is for Brooke, and how you're implementing social distancing.
Currently, we're ranging from, it's been less than 10 each day. And, the instructors or the counselors, my lifeguards, are doing the best to kind of explain to the kids, like air hugs from far away, because these kids are getting so attached, and it's really hard to not have that typical day camp environment. So we have provided masks for all of the staff. They are keeping, the numbers are just kind of keeping themselves small, which is great, which I think is partially attributed to the city, the different departments doing telecommuting schedules and everything. So it has been fairly low, and we are keeping the same staff working. So it's just kind of been a lot of communication and figuring it out that way.
Thanks, Brooke. Matt, City of Concord, District 3, you put something in the chat. Do you want to expand upon this SOP you're talking about? You still on?
Yeah. So this conversation actually happened a couple of weeks ago with our city manager. One of the reasons we actually chose to close our aquatic facility prior to even sort of the mandate that we all do it was, I'm fortunate enough to have a city manager whose daughter works for a neighboring agency as a lifeguard. And so she had some serious concerns about our staff providing any sort of medical or trauma care on the pool deck in light of the current situation. So at this point, our city attorney has requested that when we do roll to reopen, I don't know about everyone else, but about 2 years ago, all of our procedures were approved by the Contra Costa Emergency Medical System. So I've been in contact with their medical director pretty regularly through this. And we will need to have approved guidelines by CCEMS for what our staff can and can't do functionally on the deck when this happens. We'll have to provide that for our staff, and then we're kind of leaning the direction of, because of the potential concern of health, that any staff over the age of 18 will be allowed to make a decision for themselves. Any staff under the age of 18, their parents will have to sign some sort of permission form, that identifies they understand the risk associated with the activity that we might be asking them to engage in. If that helps or not. If that sort of answers that question.
Thanks, Matt.
No problem.
Does anybody have any questions for Matt? Okay.
So I got, Keith asked if I could send out who I've been talking to. I can, for anyone in Contra Costa County, I can send out who the medical director is for CCEMS. And he's actually really good about responding to stuff, at least from me, pretty quickly, so.
And hey, Matt, this is Keith with San Ramon. So that is a self-imposed, meaning city-imposed guidelines that have been mandated, not a county mandate. Is that correct?
Correct. This is solely our city's heading this direction. So it's not county mandated. Like I said, my city manager, her daughter works for the city of Walnut Creek. And so the plus side is she understands our profession more diligently than I sometimes would like. But the downside is like she has all of these concerns about what Walnut Creek is requesting her daughter to do. So she has asked our city attorney to have all of these things in place for when we reopen. So yeah, I'm having to respond to that.
Okay, thank you. Looks like Kat Kelly, Town of Mammoth Lakes. Interesting situation where I'm hearing on the grapevine that staff is thinking it's better for them to collect unemployment rather than come to work. Karen from Mission Viejo, you furloughed all your part-time staff, including lifeguards. We have to wait to get the okay for reopening. Policies and money, same with guidelines from risk management legal with city. Let's see. Becky Hurst mentioned, I have concerns that this will become a common issue because of the bonus of 600. Becky, can you expand upon that?
I can if I hit the mute button right. I don't know that this is going to be so much a problem for seasonal aquatics, but I know that I had a bunch of part-time daycare staff that I had that's laid off right now. And at first I was very, I mean, I'm still concerned about them, but I was very concerned about them because, you know, the unemployment isn't going to be complete income replacement. And most of them were working 20, 25 hours a week, and some had second jobs, some were students, etc. But the way that the rescue package, stimulus package is coming out is that it's giving everybody who's collecting unemployment an additional $600 a week. So most of my daycare staff that I laid off at this point are probably making more on unemployment than they would coming back. So I don't know how that's going to, like, it's a concern of mine when I try to start up again. If I'm starting up before July 31st, is that going to be a problem? Because why would they want to come back to work before then? I mean, other than the intrinsic reward. But it's hard to, if you're already a part-time, not highly paid worker, it's hard to just look at intrinsic value and not at money when you're trying to figure out what to do with your time, I guess.
So Becky, Kat Kelly here from Mammoth Lakes. It's a big concern of mine. Most of my lifeguards are seasonal employees from our ski resort. So they tend to be a little older. They're independent from their parents, but they're doing minimum wage jobs on the mountain, and then they come and work for me for my short 3-month seasonal pool. And a lot of them are saying right now, yeah, we're going to be making $900 a week with state unemployment and federal unemployment. So I'm really concerned that if we do get a go ahead to open, that it's going to be really hard for me to find staff for a month, basically, because we're only open till the end of August. So if they're getting the stimulus package till the end of July, it's tough to get people to come in just for that month of August.
Yeah, and for me and my daycare, I was thinking, you know, of course you want to try to get it open as soon as possible. I was already planning on doing a soft open, so probably not opening all my sites at once, because I didn't think that the public was all going to jump on board to, not everybody else was going to go back to work, not every, you know, so that it would open up slowly. Aquatics could be even more complicated, and most of us that have seasonal aquatics that aren't hiring from a ski resort, those are people who maybe weren't working already. But my understanding of the law is if you're getting any unemployment, then you're getting an additional $600. It's kind of a weird loophole. So if you have any students that were maybe working 10, 20 hours a week at a part-time job while they were in college, they may also opt not to come back once they start getting that check and realize that going to work would actually be a pay cut.
Right, that's my understanding as well. And I actually spoke to some staff that were laid off from the Hill, and last week they received their first unemployment check with the additional $600. So they're thinking life is great right now.
I see a question on here about the date. From what I can tell, the stimulus package is valid through July 31st, and then there's talking about extending it, but right now through July 31st. So if people are on unemployment, it might make working for Aquatics pretty unattractive for them because they wouldn't be interested in work till August.
Right, and we also have the same problem with our summer camps because all of our counselors typically come from the mountain.
Kind of part of my own thinking, and this is just personal opinion, is just that maybe the people that are making these decisions are already knowing that we're going to be locked down the whole summer, and they're not telling us that, but they're setting us up to have money when they do that. And it sort of has me, since I sort of did the math on that, I've sort of been like, I'm still running my numbers and doing my pre-planning, but in my heart, I'm a little less like thinking it's going to happen because my guess is that they set it up in place because they think they're going to be locked down for a long time. But that's just my own, I don't know, way to logic it out. I don't have any information that states that that's going to happen.
Thanks, guys. It's a really good conversation. I'm going to move on to program in a second, but one of the things that I want to suggest, because really Aquatics we're supporting everybody across the board. Yes, the CPRS Aquatic section and CPRS is a membership organization, but again, we're here for everybody right now, so anybody is welcome on these calls. We don't care if you're a member or not at this point, because we are all in this together. One of the things that I want to suggest doing, and I know that a handful of the board members have done this, if you don't already have a Facebook page or an Instagram account, like not a page, but a Facebook account and an Instagram account, I would, even if you're kind of against it, I would recommend doing a professional one, only so you can get tapped into groups like our Facebook pages and different aquatic groups. Couple ones I want to go ahead and plug right now outside of our regular CPRS, California Parks Rec Society, and our aquatic section Facebook page. There's also AOAP, Association of Aquatic Professionals, the NRPA Aquatic Network, but then there's also our operator groups, NACAMA, Northern California Aquatic Management Association, BAPOA, the Bay Area's Public Pool Operators Association, SCAPOA, the Southern California Public Pool Operators Association, and San Diego Council. They all have Facebook pages. I don't know how active they all are, but they all have Facebook pages, and there's another way to connect. There's also other groups that have been really active. So Peter Byers already mentioned Lifeguard Authority. There's been a lot of posting on it the last couple of weeks and a lot of opportunity for webinars. Equitable Aquatics, the NRPA Aquatic Network, Aquatics International Aquatics Tribe, and then the Aquatics Director and Managers. So again, if you guys don't have a Facebook page or you don't have an Instagram handle, go ahead and just create your own profile and join some of these groups, because a lot of these conversations are happening over social media. And then just before we go into program for our last 10 minutes, aquatic section specifically, we do have our monthly meeting tomorrow at 11. The information went out to membership. Members are welcome to join. We do have an agenda associated with it. It is technically our first official meeting of this particular board year. A couple of things to be aware of that we are going to discuss with our annual, but that's going to affect our annual budget that we're going to be creating here soon. It's going to be our professional development scholarships, CAMS, because it is the 20th year anniversary, and whether or not we should even be holding it, with how much money we would be on the hook for, and then just possibly relief and offering free section membership if you're already a CPRS member, just so you can be a little bit more tapped in. So just a couple of topics I just want to make sure that everybody is aware of. If you are a CPRS and aquatic section member, you are welcome to join in and listen to those calls. And I know several of you not on the board have jumped in on those calls and listened. So, so I'm going to circle it back to programs. So we talked a little bit about lessons. Has anybody thought about, like, once, if and once we get staff back on board, has anybody really thought about how they're going to bring program back online, with everything that we've already had to cancel? So, and what's that going to look like? What are you going to bring back? What's that going to look like? Drop-in versus registration based programs, water aerobics, whatever. Does anybody want to share what their thoughts have been so far?
I can jump in that. Again, as I said earlier, I'm definitely thinking like a slow start, like probably less swim lessons. Swim team, maybe it's practice only if it's going to roll out, but probably not. I don't see swim meets happening, because even when, as it's sort of been alluded to, even when things open up, there's going to be a limit on the size of gatherings. I'm expecting to probably open my smaller pool first, which again seems kind of counterintuitive. If you're just going to open one pool, open the big one, but because I can control the attendance better. And then Colin and I have been discussing the option of maybe only offering private swim lessons, because that will at least only have a contact with one person at a time and won't have the larger groups. So, I mean, we're looking at it, but until we have actual information onto what the expectations are going to be, nothing solidly planned.
I was actually talking to Cortez from City of West Hollywood last night, and he was thinking about only, I don't know if Cortez is on the call, but he had mentioned to me they were thinking about only doing privates as well. So quick thank you to Stephanie. You said that you're going to go ahead and post a bunch of those groups that I just mentioned on the Facebook, our Facebook aquatic section page. Brian Wilson is saying conversations with local school district regarding swim lessons as part of physical education in the fall. Let's see, Russell from Pleasanton, the possibility of doing senior hour for lap swim, water aerobics. We've limited number of classes and ratios within them. We do have 2 big teams that rent the space. So we need to discuss how we're going to handle them, their age groups, and then physical distancing. And then Colin, who works with Becky at Sunrise, family semi-private lessons as well. Anybody else want to chime in?
Hi, Terry. This is Cortez. I actually am on the call.
Perfect. Yay.
Yeah. We are thinking about just offering private lessons. The other thing is how the locker rooms, because you and I were discussing this, like how do you manage and monitor that? Because the social distancing there can be really difficult, especially if you have like an older facility, like our facility is ancient. So we have to also monitor just how many lessons or how many people we're allowing the facility at a time, just for that mere thing of like, how do you police that? And our staff having to be in a position where they have to police the social distancing. If you have a demanding population, which a lot of us do, we're going to be put in that situation. So those are some of the things we're just looking at.
Thanks, Cortez. Before we move on to Karen's question about Water Safety Month, so for CSD, for Consuma CSD, we have 2 massive swim teams, and water fitness classes, swim for fitness, a huge lesson program at all of our facilities. And we're looking at more of a tiered approach, but no decisions have been made because we're still waiting for some of those guidelines to come down from state and county guidelines as far as what we're going to do. But yeah, we're looking at everything from other things that have popped up of like just private lessons, inviting parents in so the instructors don't have direct contact with kids, and limiting how many lessons we actually have. It looks like Hale is mentioning or talking about letting people in waves. So doing like 1 to 2 o'clock, 2:15 to 3:15, 3:30 to 4:30, and lowering costs this summer. It's the first time I've heard somebody talk about adjusting their rec swim rates. So that's interesting. Anybody else? Are there any questions anybody has that you want to make sure that we try to research between now and next week to touch on? If you have those questions, again, just go ahead and put them in the chat. Hey, Hub. So Karen has CPRS Aquatics put out virtual or branded info in regards to Water Safety Month. Do you want to go ahead and talk on water safety, what we're doing with Water Safety Month?
Sure. So yeah, we have a plan right now. We're actually going to be sending out sample water safety proclamation templates. If your council is willing to, or your board of directors is willing to make that proclamation, at least you'll have the document ready to go that you can plug your agency name into and get that moving forward, because it would be recommended to probably start on that now, so it gets approved sometime in May at one of the council meetings. Water Safety Day itself is, I think it's May 15th. Sorry if that's wrong. Yeah, it's May 15th. It's a Friday. So what we're looking at doing is doing some sort of social media campaign with that, where everybody wears red and shows support for Water Safety Month. So if we're back in our offices, you could do it with your staff or your department staff or what have you, and post those pictures on social media, or send them to the aquatics section so we can post them on our social media. And I know there's a post on social media right now on Facebook about a Water Safety Month hashtag. So if you have any good ideas, clever ideas for a hashtag, so we can kind of make it a branded campaign throughout the month, your input would be much appreciated. Otherwise, we are partnering with several water safety organizations throughout the state, and hoping to highlight one or two a week for the first half of the month, showing what they do and what resources they have available to help us with water safety advocacy. And then we're working on a potential webinar for the end of the month that would be like case studies of drownings and things like that. And maybe an opportunity for all of those partner organizations to get together at like a Zoom call or something that we can, have a chance to chat and share resources and things like that. So that's the general Water Safety Month plan in a nutshell. If you have any other ideas or, suggestions, we're always willing to hear them. But that's kind of where we're at as of today.
Thanks, Andrew. Appreciate it. Does anybody have any last, let's see, Tracy, City of Pleasanton also started discussing eliminating or moving times where swim team practices occur. Okay. Wipe down locker room surfaces between groups. Okay. Yeah. Anybody can actually save the chat if you guys want the information that is in the chat and you don't want to try to write stuff down really quickly. Right where you would enter in text where it says to everyone, or to, if you select somebody, there's 3 dots to the right hand side. If you click on that, it'll give you the option to save the chat. So that would include all the links that have been posted today as well, and contact information. So if nobody else has anything else to say, I just want to, kind of like I've done for past calls, if there's anybody on the call from the state board, I'm kind of looking and I'm not noticing anybody right off the bat, but if there's anybody on the call from the state board that would like to say anything, or anybody else from the aquatic section that wants to say anything and share for the good of the group. Okay. Well, on behalf of the aquatic section, I just want to thank everybody for being on here. We had over 100 people today. Thanks, Erin. She just gave me some props. I mean, we know this is unprecedented times, and there's a lot of uncertainty that's going on right now. And really, the one thing that I've always valued for aquatics, especially when I've worked for agencies to where I was really the only person that knew much about aquatics, it's really about the people that are in the aquatic industry, and we really support and uplift each other. and just by sharing ideas. We beg, borrow, and steal from each other, and that's just a sign of respect. So I'm just going to encourage you guys to keep checking out the different groups, getting on webinars and calls like this as much as possible. Just learn as much as you possibly can. Before we completely sign off, I do want to plug, I know NACAMA has a meeting tomorrow, the Northern California Aquatic Management Association. They're doing a Zoom call tomorrow at 2 o'clock. Jay, can you go ahead and post your email in there one last time if anybody wants that information, if they didn't already get an email with an agenda from you. But again, tomorrow at 2 o'clock. NACMA is blanketed under District 2, so we were able to get CPRS to support a Zoom call like this for NACMA's call tomorrow. So I would encourage you guys to join on that as well, especially if you're within the District 2 boundaries. With that, again, just want to say thank you guys, and thanks for joining us for the 3rd week in a row. And Stephanie's saying, okay, info will be on our Facebook page and the CPRS website in the aquatic section communities. We'll also send emails. So yeah, so thank you guys, everybody, for joining us. We appreciate you. We appreciate everything that everybody's doing. You guys are awesome, and we'll see you next week. Cool. Bye, everybody.
Thank you, Terry.
Of course.